Hi everyone, I'm Kat. Today I will be going to talk about the Parkinson disease. It's a neurological disorder and now the leading source of a disability globally, and aging is increasing the burden of neuron degenerative. Parkinson disease is a common chronic and progressive neurodegenerative disorder, which is the second most common condition that affects predominantly dopamine-producing neurons in substantia nigra in the brain. The main neuropathological finding is the appearance of alpha-synuclein containing Lewy bodies. Also, the cause of Parkinson's disease is unknown in most cases. However, the genetic risk factors have been identified. It can be identified in 5 to 10% of the patients. It is commonly epidemiology. This is shown by the statistics where more than 10 million people worldwide are living with Parkinson's disease. In Australia, there are over 110,000 people, and it's estimated that 4 people per thousand with Parkinson's disease, with the incidence increasing to 1 in 100. The cost for Parkinson's disease is extremely expensive as the economic cost statistic showing that in 2018 the total economic cost of Parkinson's disease patients worldwide is estimated at over $12.3 billion. The primary pathologic feature of the Parkinson's disease is associated with the loss of dopamine. It prevents the normal function in the basal ganglia and causes motor symptoms. The pathological traits of Parkinson's disease are the dense of the midbrain substantia nigra. The local ceruleus is undepigmented. The substantia nigra pigment is lightened. These pathophysiologic traits prevent the impact of damage in the dorsal motor nucleus of the vagus nerve. The olfactory bursts the nucleus, then the locus ceruleus, eventually the substantia nigra, and the caution area of the brain are affected at a later stage. The damage to this rabbit neuron system occurs from the miscellaneous pathophysiologic change that cause the impairment of not just the motor system but also to the cognitive and neurophysiological system. The symptoms for Parkinson's disease presenting with a combination of bradykinesia with tremor, rigidity, and posture instability. However, it is a chronic and progressive disorder caused by degenerative loss of dopamine. The clinical diagnosis is based on its features such as a unilateral onset of persistent asymmetry. The presence of a bradykinesia as either tremor or rigidity must be present. Also, CT scan and MRI is able to check for abnormal signs. Nowadays, one of the advanced therapies is called neurons, belong to adenosine antagonists by blocking the brain chemical adenosines. Those boost the signaling of dopamine. The adenosine inhibitors is another potential downstream therapy. They heighten the downstream effect of levodopa. The adenosine inhibitors also reduce freezing of movement. Where it's different from the current therapy that low patients, blood pressure, and causes sleepiness. Adenosine inhibitor able to increase the blood pressure and act as stimulants. The last therapy will be neuronibit. It can remove the dysfunctional alpha-synuclein that accumulates in Lewy bodies. The removal of the abnormal alpha-synuclein reduce symptoms or modify the disease course. This drug is trisynchrony inhibit result. Immortal. The one of the future treatment is a transplanted stem cell, which is derived from dopamine neuron precursors. Treat for the nuclear cell loss and cell injury. The management of the disease will be by replacing the stem cell for the lost cell clear the pathological coma. Stem cell offers the possibility of a renewable source of the replacement cells and tissue as a form of innovative treatment in regenerative medicine. Another future treatment is a molecule called BT13. It's able to boost the dopamine in the brains of mice. It's also appeared to protect the brain cells tasked with dopamine production. With dying off, also it was able to bypass the blood-brain barrier, which is important as one of the biggest challenges for Parkinson research is how to get drug past the blood-brain barrier. So the exciting discovery of BT13 has opened up a new arena for research to explore, and the molecule whole grain promises as a way to slow or stop Parkinson's. Thank you for your watching.